Today we will talk about human teeth, their structure, how to number them, and how to tell how old they are. Teeth are found in the jaw in two sets, upper in the maxilla and the lower in the mandible. Adults have 32 permanent teeth, whereas children only have 20. A tooth has a root sitting in the alveolus, a crown, the top of which is covered by enamel, which is a hard tissue, dentine, tissue found within the tooth, and pulp, tissue found within the pulp chamber at the very centre of the tooth. They are innervated and vascularised, so have both nerves and blood vessels which enter through the apical foramen. Each tooth sits in a bone socket, aka an alveolus, within the maxilla and mandible. The roots are held into the alveolar process with periodontal ligament, which inserts into the cementum, which covers the tooth roots. There are 4 types of teeth: incisor, canine, premolar, and molar. An important part of describing a tooth is directionality. The front surface of teeth is called labial for the incisors and canines, and buccal for premolars and molars. The back surface is called lingual. The top surface, aka where the chewing happens, of a canine or incisor is called incisal, and occlusal in premolars and molars. The sides also have their own names. A surface facing towards the midline is mesial, and a surface away from the midline is distal.
In terms of identifying teeth, there are several methods for numbering and naming specific teeth present in skeletal remains. These include the Zsigmondy system, the Universal Numbering System, and the FDI system. The teeth being numbered include incisors, canines, premolars, and molars. Generally, when numbering teeth, 1 and 2 represent the first and second incisor, 3 equals the canine, followed by 4 and 5, the first and second premolar. 6, 7 and 8 indicate the first, second and potential third molar. Teeth can be used to determine the age of an archaeological skeleton at the time of death. One method of identifying the age of the skeleton involves looking at the physical features through morphological techniques by studying the pattern of wear on the teeth. Using a chart, attrition, or the wearing of teeth, can be used to estimate a group age of the skeletal remains. When trying to identify age by teeth, it is important to note that children have 2 dentitions, deciduous or baby teeth, which are replaced over time by permanent or adult teeth. With deciduous teeth, it is generally considered that they consist solely of incisors, canines, and premolars. The differences between permanent and deciduous teeth include the fact that the enamel differs over time, in that milk teeth are more translucent and paler. In addition to this, deciduous teeth and their roots are smaller than permanent teeth. You should now know more about the structure of teeth, numbering, and age determination of human teeth.